topic of secondary hypertension. I am here, Dr. Rahul Jain, and this topic is being presented under the guidance of Dr. Sharda Jain. So let's go about it. Basically, what is secondary hypertension? So secondary hypertension is a hypertension with a cause. So normally, with the hypertension we talk about in middle-aged elderly population is essential hypertension. That is hypertension without any cause. Or there are some multiple hypotheses has been given. But as we talk about secondary hypertension, it is a hypertension with a cause. So I have put up some very common causes which you would like to see in common population. So as I had discussed earlier also, it is related to renal causes mainly. So kidney is responsible for this hypertension, secondary hypertension. So the most common cause of secondary hypertension is renal-parenchymal disease. So all your nephritic syndromes, nephrotic syndromes, any kidney-related diseases, even diabetic nephropathy, which is very common, the incidence is rising every day, your renal artery stenosis, all these comprises the most common cause of secondary hypertension. Followed by it, hypothyroidism and hyperthyroidism, either of them, either increased thyroid activity or decreased thyroid activity. So incidence of hypothyroidism is very high in the population, but that hypothyroidism causing secondary hypertension is rare. So it is second most common cause after renal diseases, followed by adrenal causes and even PCOS. Very important increasing problem in young females, and the cause of secondary hypertension in PCOS is because of insulin resistance. And then there is even obstructive sleep apnea. So history of snoring is very relevant here. So now how to rule out? So very important is we cannot rule out all the causes of secondary hypertension with basic investigations, but at least we can always rule out some most common causes of secondary hypertension from some basic investigations. So how to go about it? First of all, history. History is the most important tool in every single aspect of medicine. So we have something called a system review. So we should always rule out systemic symptoms of every single system present in the body with just a 1 minute brief history. And as we can also see that most common causes renal parenchymal causes for secondary hypertension, we should always rule out the renal history, like any history of facial swelling in the morning, or any change of color in urine, any decreased urine output, or any burning sensation. So history is a very important clinical, and it's easy to find out through history. Then after that, we should go always get some basic investigation, as we had also discussed yesterday, like serum electrolytes, urine routine, USG abdomen, urine routine, TSH electrolyte. But there is reason for each and every investigation. So if we go back, if we can see that hypothyroidism, renal-parenchymal disease, and adrenal causes are the first 5 major common causes. So if we get done serum electrolytes, urine routine, and serum TSH done, then we can rule out these 5. Then probability of missing out a secondary hypertension patient becomes very less. After we rule out these diseases, now when to suspect in a patient that he might be having secondary hypertension and not essential hypertension. So if we see a patient of essential hypertension, he'll be commonly middle-aged male, obese, will be having history of type 2 diabetes mellitus, and will be accompanying metabolic syndrome also. So if we see, and BP will be usually in the range of 140, 160, by diastolic almost 100, or maybe going up to 110, but not more than that. But any deviation from these parameters should alert us for the diagnosis of secondary hypertension. So if I see some young person coming at the age of 26 with a hypertension, even 160 BP, it should raise a suspicion that it might be secondary hypertension. If I'm seeing a thin individual coming with hypertension, then also it should raise a suspicion. And if I am seeing at any point of the time BP is 180 and it has never been diagnosed before, then I should suspect it is a case of secondary hypertension, and I should rule it out first before starting the drugs for essential hypertension, because if we start drugs for essential hypertension and the patient was secondary hypertension, then it is equivalent to giving death sentence to a patient. And always rule out any vomiting, headache, urinary symptoms, weight loss. Again, for ruling out the secondary hypertension from the history point of view. Then in the end, I like to come to the treatment for secondary hypertension. So there is first.
Rahul will ask two questions. You
Yes,
said
ma'am.
that it should be a middle-aged male. You think the female can't have it? Female can also have it.
Yes. So even if a female is getting, we would like to suspect that there is a possibility of secondary hypertension. The usual profile is middle-aged male.
But
So
the vomiting, weight loss, what does it point it out?
So any weight loss. So weight loss can be associated, first of all, will come to urinary symptoms. So if we see urinary symptoms, they all can rule out all our renoparenchymal diseases, renal artery stenosis. Always rule out any vomiting, headache, urinary symptoms, weight loss. Again, for ruling out the secondary hypertension from the history point of view. Then in the end, I like to come to the treatment for secondary hypertension. So there is first.
Rahul will ask two questions. You
Yes,
said
ma'am.
that it should be a middle-aged male. You think the female can't have it? Female can also have it.
Yes. So even if a female is getting, we would like to suspect that there is a possibility of secondary hypertension. The usual profile is middle-aged male.
But
So
the vomiting, weight loss, what does it point it out?
So any weight loss. So weight loss can be associated, first of all, will come to urinary symptoms. So if we see urinary symptoms, they all can rule out all our renoparenchymal diseases, renal artery stenosis. We can't actually rule them out, but the possibility of coming them in confirmed diagnosis investigation becomes less with time.
Yes.
Also, vomiting, the adrenal causes are associated with weight loss and vomiting.
Okay. Done. Come, go ahead.
Yes. And now treatment. So first of all, there is no specific treatment for secondary hypertension. It is very cause oriented. So if it is insulin resistance, we need to treat insulin resistance. If it is pheochromocytoma, the patient might be requiring surgery or specific drugs. So there is no common treatment for any secondary hypertension and it is have to be only treated in emergency. But if the hospital is far and patient is conscious and well oriented, then we can just give a tablet of amlodipine 10 mg for time being, so that really high BP doesn't cause immediate acute problems like some intracranial bleed or something like that.
Perfect.
Amlodipine 10 mg can be tried. So that's it. I will
given,
conclude.
and it can be within half an hour. It can be repeated also.
Yes. I would conclude secondary hypertension here itself. Then let's go on to the second topic, diabetes mellitus from here.
So you introduce again diabetes.
Yes.
I think this has been great.
Yes. So yes. Good morning. Today let's discuss diabetes mellitus. I'm here, Dr. Rahul Jain, and this PPT is being conducted under guidance of Dr. Sharda Jain. Even though diabetes mellitus as a subject is a huge topic, but I have tried to cover every single thing in this session. So I think it will be helpful for all of us.
Rahul, this I wish to tell you is that this is all for all doctors who are specialty doctors and general doctors, that they time to time they revisit their subjects. So all specialists have forgotten a little bit. Once you go through these slides and discussion by Rahul, I think things become very clear to you. Over to you, Rahul.
Yes. In this PPT of diabetes mellitus, I have tried to include every single new updates and every single thing related to diabetes.